Welcome to the Specimen Not Found podcast. This podcast explores the life and careers of clinical laboratory science professionals and discusses issues that can help inform other members of the healthcare team and the public about what makes clinical laboratory science such a critical profession within healthcare. We are your hosts, Dana Bostic,
Drew Jones,
and Letycia Nunez-Argote. Today we are here to dive into the hottest topic, COVID-19. We will look at the science behind the virus itself, how and why it's spreading so efficiently, and how this is affecting life as we know it across the world.
So there are a lot of different coronaviruses throughout history, just not very many that are actually effective in hurting humans, if you will. So it's named coronavirus after the Latin word for crown, which is corona, because the structure of the virus itself, and I'm sure you've seen many pictures of it by now, is crown-like. So we'll get into what all this other stuff on it is going to do to you later, but for a long time, we only associated coronaviruses with the common cold. It is widely known it's the second leading cause of the common cold behind rhinoviruses. And there have been two big outbreaks prior to COVID-19 of pathogenic coronaviruses. And those were SARS in 2002, which stands for Severe Acute Respiratory Syndrome, and then MERS in 2012-2013, and that's Middle Eastern Respiratory Syndrome. Both of these outbreaks did result in human fatalities, but not nearly to the same level that we've seen with the 2019 novel coronavirus. What's caused this seemingly non-pathogenic group of viruses to spit out this monster of a virus? And it's always important to look at history and learn from the past. So first off, the SARS outbreak in 2002 happened in China. The first case came out in November of 2002, and then it really hit the national news media in March of 2003. The outbreak worldwide produced more than 8,000 cases and resulted in little under 800 deaths. And this was between November of 2002 to July of 2003. With this virus, we saw a much higher mortality rate than we have seen so far with the novel 2019 coronavirus. SARS, the general range is about 10% case fatality rate. In the United States, we only ended up having 8 confirmed cases, and all of these individuals had traveled to China in the region where the outbreak was going on. Some of the symptoms we saw with SARS, fever greater than 100 degrees, mild respiratory symptoms, and a dry, non-predictive cough that comes along 2 to 7 days after inoculation. This, with SARS and with our new virus, can progress into hypoxia and may require mechanical ventilation. Ultimately, they saw pneumonia, and then the prognosis, as we've seen with this virus, depends largely on age, sex, and overall health status of the individuals. With that first SARS virus, the cases appeared clustered and then ultimately spread out. There were multiple viral strains of the first SARS virus, and we've seen that now with our COVID-19. They've sequenced out at least 3 different viral strains, and that mutation explains why we're seeing different presentations clinically. Other than that, like with our new virus, we're seeing person-to-person contact result in the spread of the virus, coughing, sneezing droplets, as we've seen with COVID-19. When we get on to the MERS virus that we saw in 2012, like SARS-1, it was higher mortality rate than we're seeing with COVID-19. And that's one of the good parts about our novel coronavirus right now. As the end of the beginning of 2020, we'd seen 2,500 laboratory confirmed cases of MERS, and that has included 866 deaths. So that gives us a fatality rate of about 34%, so much higher than we're seeing right now with COVID-19. Like COVID-19, the age groups most susceptible to MERS were greater than 50 years old, and that number, the fatality rate boosts much more when you get over 70 years of age. So while MERS is still around, we see small outbreaks from time to time, primarily in Saudi Arabia and the Middle East. It hasn't had the same outbreak impact that it did in 2012. Now, the most similar outbreak that we've seen in somewhat recent history to our coronavirus was the 1918 Spanish flu. Most of the people who were alive at that point in time are no longer with us, but the Spanish flu caused an outbreak on similar levels that we're seeing with today's virus. So, fun fact, the Spanish flu, some believe, actually originated here in Kansas. So we have a lot of experience with outbreaks. But the difference between Spanish flu and what we're doing with COVID-19 is that the Spanish flu affected young and healthy individuals. We saw it widely spread due to the war that was going on at the time, where healthy soldiers would come down with symptoms and within a few days could fall deathly ill or even die. The flu itself killed approximately 40 to 60 million people worldwide, depending on your source, and 675,000 people in the United States. And that was over a 4-month period. At the time, that represented 0.8% of the world population. And in all of recorded history, only the Black Death has caused more deaths from a single outbreak. So just to put that in context for you, the Spanish flu killed 10 times more people in the United States than World War I did. It killed 2 times more people than the AIDS epidemic. And again, we believe it actually spread out of Fort Riley here in Kansas and then went out worldwide due to the war that was going on and really took grips in Spain and then spread out from there as well. So what we really want to learn from that outbreak is what mistakes we made then and how can we improve upon that in our current outbreak. And the biggest thing we learned, and we can go back and study, is the importance of social distancing and isolation. So there's a ton of case studies out there, and I'll put some links on LinkedIn if you would like to look at them, to some of these articles. And Kansas City did a really bad job at that time with isolation. It comes back, if you know your Kansas City history, to Boss Pendergast ran half of the city at the time. And he was in charge and ran a lot of the manufacturing facilities at the time. And he didn't want to shut them down despite what local government officials were telling him to do because he didn't want to lose the money. So they stayed open 2 weeks later, at least, than St. Louis, who's a much bigger city at the time. And at the result of that, Kansas City saw a much higher case fatality rate than many other bigger cities. What we really learned is following these government implemented shutdowns of businesses, shutdowns of gatherings, and social distancing really makes a huge impact when it comes to the ability to prevent the spread of this disease. So that's enough about the historical aspect of it. Now I'm going to throw it over to Miss Letty, who's going to talk about what's going on with this virus.
Thank you, Drew. And I really appreciate learning a little bit more about the Kansas City history of linked with these types of outbreaks. Regarding the COVID virus itself, we have been reading a lot on credible sources like the CDC and others, and they've been telling us a lot about what this virus looks like and what it does. So as Drew mentioned, the coronaviruses are spherical viruses that have an outer glycoprotein layer that helps them insert and fit like a lock and key with specific types of cells, including the cells in the lungs, which helps them infect those cells so they can use those the machinery from those cells to replicate. One of the things that they've been looking at is the glycoprotein spike that uses the ACE2 or angiotensin converting enzyme 2 receptor to help this virus insert its RNA into those cells. So we are going to add some of those links into the description if you would like to learn more about how this coronavirus uses these receptors to infect cells. Now, the COVID-19 is actually what we call a zoological virus, and it's spilled over into humans from bats, and it's also actually believed to be spread via a small and adorable animal that you can see on your screen that's called the pangolin. Going back to how it infects our cells, is the coronavirus will attach to those receptors and insert its DNA. These receptors are mainly found in the lungs and the GI tract. Now, a little segue on this. A lot of my family members are asking, like, why do we care about the GI tract, respiratory disease? And I want to remind everybody out there that when you're sleeping and you are sick, you sometimes do swallow your spittle, and there are viruses in there, and those viruses can make it into your GI tract and infect those GI cells. So just, to keep that big picture, this is why we are also worried about the GI cells, because they are also susceptible. If the virus makes it all the way to your GI tract, they can actually become infected and you can have GI symptoms. More links to come on that too. And so once this virus attaches to its targets, it's going to be introducing its RNA, which is going to start translating into proteins that are going to be coding for the different components of the virus. And then after all of the different components are put together, these viruses will actually be able to go out and infect other cells. So the result of this disease process is very similar to what we see in the different outbreaks of SARS that Drew was mentioning. So we see the viral replication, hyperreactivity of the immune system, and pulmonary destruction. Particularly with hyperactivity of the immune system, once your immune system starts looking and seeing that disinfected cells are displaying the different proteins from the coronavirus, the immune system is going to react and try to start destroying the cells that are infected, which then in turn is going to cause a lot of damage to your lungs. And that damage can actually be visible using CT scans and other imaging technology. And so early in the disease, you're going to get the mucus and cilia in the cells in the airways becoming infected, then the cells are going to slough off and perish and into the lungs, where they are going to start accumulating. And this accumulation in the lungs is going to cause more problems, including hypersensitivity of immune response that is going to be leading to that dry cough and breathing difficulties. So that's at that early stage. As we progress in the infection, lesions in the lungs are going to be seen as holes, they call it honeycomb type structures in a CT chest scan. And it results from, again, that hyperactive immune system that is trying to destroy those infected cells. Then that is going to cause hyperpermeability of your alveoli and fluid to leak into the lungs. Then that's going to cause a decreased capacity for oxygen to travel into the blood, and that might actually be fatal. There is an additional category to an infection with COVID-19, which is a critical infection, in which case what we call the super worst case scenario, is that it can lead to death. And that would happen when the immune system is so overwhelmed and trying so hard to get rid of this virus that it actually causes an overproduction of cytokines. Now, usually cytokines would be messengers that would be contained and that would help our body just react enough, and then they will be shut down. But in this cases, there's such a large and overwhelming inflammatory response that the blood vessels are going to increase permeability, fluid seeps in, and it's difficult for the blood and the oxygen to reach the rest of the body, and that's going to lead to organ failure, and if not treated adequately, it might lead to death. Most cases present with the common symptoms. So that's something that we've heard in the news and from the CDC officials and World Health Organization and everyone else. This fever that Drew talked about, over 100 degrees. And then that's going to be that dry cough. And also other like clinical symptoms. You're not feeling well. You start feeling those cold symptoms coming in. And then several days after, patients might experience shortness of breath and fatigue, again, because of lack of oxygenation into the body. And if kept untreated, the symptoms can increase in severity. Just remember, if you're feeling any of these symptoms that are being described by the experts, that is when you want to try to seek medical care and not before. We are not trying to detect people to rule them out from being sick with COVID-19. We want to rule them in if and only when they are starting to feel those symptoms that we've discussed. For therapeutic approach to COVID-19, there's different strategies and different evidence that's been put out regarding the therapeutic approach. We actually have a couple of sources that have evidence from treatment to try to help people get better with the virus. This would include antiviral drugs. They're also proposing treatment with the angiotensin receptor blocker, ACE inhibitors. And one thing that I did find out from one of the reports that we received from one of our colleagues is that plasmapheresis with antibodies from humans who have recovered from coronavirus can also be a potential source for treatment, because that would help those people who are acutely infected but have still not developed their own antibody immune response to slow down the viral infection so that they can catch up and try to destroy it on their own. So that's something else that we've seen for that. We're going to add a link to a very good video that talks about the capacity of treatment with ACE inhibitors, and we encourage you to look at it if you want to learn more about how those are being proposed as a treatment for this type of virus. I think that, we could talk about it, but I think I want to give credit to the author who spent some time trying to explain that if in any case, yes, the immune response to this virus, it can be very sudden and very acute and can lead to severe consequences. So if you are out there and you're starting to feel these symptoms, please make sure you contact your health professional. With that, I'd like to pass it on to Dana because she's going to give us some really great information about how to prevent the spread.
Thank you, Letty. So now let's talk about how does this spread. So you've already heard on our various news outlets and through our resources such as the CDC and the World Health Organization as far as it is passed person to person. This is a respiratory disease. So if someone coughs, if someone sneezes, being in close contact with people who are infected with coronavirus, specifically COVID-19. This is why it has been strongly advised and recommended that we remain 6 feet from each other, hence the social distancing piece that we talk about. More physical distancing, I like to elaborate on. By keeping a safe distance, even if someone appears to be asymptomatic, but they sneeze, this is just a good way to ensure that we're not constantly spreading the disease. We want to slow down the spread. Also, these respiratory droplets from infected persons can come into contact with the mucous membranes, which is why, once again, we're encouraged to not touch our face, not touch our mouth, our eyes, our nose. This transmission, once again, it can also come from touching contaminated surfaces. And if you're touching a contaminated surface and then moving your hand to one of your mucous membrane areas, such as your mouth or your eyes, or even the food that you consume. So if you touch food with now contaminated hands, and you're consuming that into your mouth, you may be ingesting that virus. Also note that the virus can live outside the human body on various surfaces, whether that's plastic, metal, what have you, for up to 10 days, depending on the surface type. This virus itself can spread from asymptomatic individuals, as we saw amongst professional basketball players and actors and politicians, as you've seen so far. The virus does not discriminate based on economic or socioeconomic status. We are all privy to this virus. So it is most likely to spread when you are at the sickest, feeling worse, if you will. Also, the mean or average incubation period has been estimated to be 5 to 6 days, but the World Health Organization does add that the incubation period can vary in a wide range from 1 to 14 days. So on average, the disease itself can last for up to 2 weeks or 14 days, as we've heard. And the World Health Organization does report that the median time from onset to clinical recovery for mild cases is approximately 2 weeks. So in our severe cases, if you look at this graph that we have here, severe cases themselves can last 3 to 6 weeks. So this graph that you're looking at last dated February 11th, you'll see that our severe cases are about 14%, which of course this number is changing as we're seeing community spread of the virus, with our critical cases being falling around 5%, with most of our cases that do unfortunately lead to death being around the 3% mark. So in talking about prevention for yourself, because of course, we want to slow down or limit or prevent the spread of this virus, we want you to wash your hands. You've been hearing this like crazy, but this is the best way to prevent the spread of this virus. Wash your hands with soap and water. And we want you to do it often. You want to wash your hands for at least 20 seconds. You've heard about singing the happy birthday song at least twice, that you will know that you have washed your hands long enough. Wash your hands to where you're also scrubbing your nails, the back of your hands, the full surface of your hands, especially after you've been in a public space or after blowing your nose, coughing, sneezing, touching a potentially contaminated surface. If soap and water are not readily available, the next best thing is using hand sanitizer. The hand sanitizer you use, you don't want it to be the pretty glittery filled ones. We want you to use this hand sanitizer that does contain at least 60% alcohol. So you want to cover all surfaces of your hands. Once again, rub them together with friction until they feel dry. Avoid, again, touching your eyes, your nose, and mouth with unwashed hands. Also, we want you to avoid close contact with others. So if your community is experiencing an outbreak, please distance yourself, hence the social distancing once again, from infected or potentially infected individuals. For everyone else, once again, this is where we're advising isolation. Stay at home if you are sick. Of course, if you're seeking medical attention, we understand that you do have to go maybe to the ER or to your physician's office. Please call ahead, though, so that way they can prepare for your arrival to ensure not just protection of yourself, but also protecting others that may be present. Also, please cover your coughs and sneezes. I saw this cute video where it talks about coughing or sneezing into your elbow, calling it the cough pocket or the sneeze pocket. So you want to make sure that you're always coughing or sneezing into your cough pocket or your sneeze pocket, being your elbow region. And also, if you use any tissue, please dispose of those in the trash. Do not reuse tissue. Immediately wash your hands after coughing and sneezing once again for 20 seconds with soap and water. And once again, if soap and water are not readily available or accessible, please go for that hand sanitizer that does contain at least 60% alcohol in it. If you are sick, wear a face mask. If you are not sick, please do not wear a face mask. We want to conserve our personal protective equipment for those that truly need it. So if you are sick and you're going to be around others, please use a face mask. Otherwise, it will not help you unless you are in healthcare or a medical professional working with COVID-19. Also, those that may have infectious diseases or potentially contagious diseases. Also, clean and disinfect frequently touched surfaces daily on a routine basis. This does include your countertop surfaces, tables, doorknobs, light switches. We already talked about door handles, your desk, your cell phones, any keyboards that you're using, toilets, faucets, sinks, anything we literally put our hands on. I've also heard of people disinfecting or wiping down their walls, but we do want to do this on a daily basis just to ensure that we are disinfecting and decreasing spread of the virus. Also, there is a full list of approved disinfectants that can be found on the CDC website, cdc.gov, or you can Google it yourself, but I would recommend going to a reputable resource such as cdc.gov to look at the advised or recommended disinfectants for use. If surfaces are dirty, please clean them using the recommended detergent or soap and water prior to disinfection. If you're using household bleach, 5 tablespoons is recommended per gallon of water. So 5 tablespoons of bleach per gallon of water. Any alcohol solution that you use should be at least 70%. And for those people who are preparing their cleaning solutions at home, we want to discourage potentially harmful combinations or mixtures. I'm trying to think of the best way to phrase this. So, for instance, do not mix alcohol with bleach. It's not going to make it more powerful or more of a killer against virus. In fact, this is going to be more harmful to you and those loved ones that live in that residence with you. So, do not mix alcohol and bleach. This actually does produce chloroform, which is harmful. Do not mix. What other combinations do we not want to mix?
Acetone and alcohol.
Do not mix acetone and alcohol. But yes, don't use bleach directly on your skin to disinfect. Don't spray your loved one down in Lysol. We've been seeing, I know a lot of this stuff is funny. We've been seeing these videos on social media. But once again, these actions are more harmful than helpful in this case. Please disinfect. We encourage that. Use the approved or recommended disinfectants. Just don't use them on each other directly. And also make sure you're not mixing harmful combinations. And so at this point, I'm going to pass it back to Drew.
This next part, we're going to talk a little bit about more of the laboratory setting and what kind of specimens we're looking at and what kind of specimens are working. So as far as testing is going on, you're hearing a lot from our different news media on the effectiveness of testing. And to be fair, this is a novel virus. We've not dealt with anything quite like it before. So what you hear in the media is somewhat slighted and tends to have a negative bias. So we're not going to get political on this. That's not the platform we're trying to take. But what's going on right now, as of last week, all the state health departments had the capabilities to do testing. That doesn't mean they have the capability to do the high level of quantity testing necessary for everybody to be tested. So that's why what Letty said is if you're not terribly critically ill and seeking medical treatment, you probably don't need to be tested. You're probably going to be fine as it is. That being said, as of this week, a lot more of the ViraCores, Quests, Mayos, LabCores have started to get their own in-house testing techniques approved. Obviously, we're not having to go through all the FDA regulations we normally would be. This is what they call an emergency certification. But what the CDC has been doing and what the basis of testing has been doing is on a real-time PCR system called Applied Biosystems 7500. What it really does, simplified down, is it takes the viral material out of the specimen amplifies the amount of viral RNA in the specimen so we can read it, and then uses a fluorescent detection technique which uses hydrolysis probes and detects the COVID-19 viral material presence or absence in the sample. Now, like I said, there's a lot of individual companies out there responsible for producing different molecular testing techniques, whether it be BioFire, or any of the other ones. We don't have any things we need to declare. Nobody's sending us money, if they want to, though. Anyway, all these other companies out there are developing their own tests. So while right now we might not have the testing capabilities for everybody to get testing, in the next couple months we should be getting there. So let's get on to the testing sample requirements. As you've probably seen, this virus can be found in the nose, lung, throat, and the oral regions. So we've tried out some couple things, and part of the issue with testing is we don't know the perfect specimen yet. We don't know where a patient is in their disease process. It makes a big difference of where you're going to find the most viral material. What the CDC, though, is recommending is the use of nasopharyngeal or oral pharyngeal swabs. And these include nasal aspirates, nasal washes, or bronchial alveolar lavage. Basically, what we're trying to do is wash out these nasal and throat regions and get as much sample as we can. We then want to place that sample into a viral holding media. They're using universal transport media at this point. It's shown to work just well. These typically are going to be stable for about 72 hours if you refrigerate them. For delayed transport, we're recommending freeze it at -70 degrees. And one recent article I actually read this morning is showing that throat specimens are showing much lower specificity and ability to show quality results. So we're still mainly recommending the nasal washes and BALs. That being said, I think we're going to open it up now for a little more dialogue, a little back and forth, and I think we're going to start off with how this is affecting our lab community and our hospital. So who wants to jump on that?
Well, and just real quick, from the laboratory professional perspective, as you know, our profession is going to be manning those laboratories, performing those tests so that everybody can feel safe in knowing what their actual coronavirus status is if they're tested. As you know, if we in the laboratory can test for multiple things. A current gold standard is what Drew just explained, finding the actual viral RNA on the patient's specimen. However, the human body is complicated, and somebody can come in and have a wash done and feeling all the symptoms and not feeling well, and we may not find the virus. And that might just be because their immune response has been so great that they're actually already producing antibodies that are neutralizing the virus, and thus kind of covering up or not providing the evidence for this test. So there are other laboratory tests we perform, including testing for antibodies, IgM and IgG, to classify the acute or chronic status of a person. So all of those other tests are going to be performed. Every area of the laboratory is critically involved in the diagnosis of this infection. In the community, we are quite concerned about the availability of reagents and kits that allow us to do our job. And so that is why in the lab community, we are stressing and prioritizing for people who are in those severe and critical status of infection, those people who may actually be going down the path of potentially organ damage, failure, and death. And so if you are feeling not great, but not necessarily going or progressing into those critical status, and they don't get your results right away, it's not because we don't want to do it, but we're doing those tests as fast as we can, but we are prioritizing for those high, severe, and critical cases because we don't want to run out of all of our reagents. Like Drew mentioned, the larger throughput laboratories are now getting involved. The FDA has waived some of the usual requirements so that they can start using their own platforms. But that doesn't mean the laboratory profession is doing a sloppy job. We already know and have high standards to begin with. So if you get a result for any of these tests, I can guarantee that all of the people behind that are doing their best they can to try to produce those quality results for you. So for our laboratory professionals working out there 24/7, big shout out. Keep doing what you're doing. We appreciate you.
Unsung heroes.
Yes, unsung heroes. Just like everybody else in the healthcare team, you have all of the different clinicians, practitioners,
Respiratory therapists.
respiratory
Gotta give them a shout
therapists,
out.
yeah, people in transport, volunteers, everyone who's currently working really hard in the health profession to help these people get better, get the test they need, and get diagnosed.
Environmental services for having to decontaminate, disinfect rooms and
Constantly,
spaces.
yes.
Exactly.
Yes. So
And so-
everyone.
Thank you so much for all the work you do.
Drew, do you want to talk about how this affects our personal community, such as our family?
Sure. So I'm lucky enough to still have all my grandparents. So as you've read and as you've been told, this novel coronavirus really affects our older community at a much higher level of severity than us younger folk. Just real quick numbers out of the Chinese outbreak reports. Typically, our case fatality rates is relatively low until you get over the age of about 60. So until you get to 60, it's usually in like the 0.5% to maybe 1% case fatality rate. Whereas once you get over 60, it's close to 4%. And then once you get over 8, that number jumps anywhere from 15 to 20%, depending on what sources you're looking at. What I've tried to do is stay in touch with my family members. I have, as I said, all my grandparents are still alive, which is fortunate, but all of their facilities are on lockdown. I can't go see my grandparents at their retirement home. I can't go see my grandmother at her house. Well, I could, but it's not smart for me to do that. So what really is important is, as Dana talked about, social distancing doesn't have to be true social distancing. It's physical distancing, what is really important. I can still call my Nana on the phone. I can still FaceTime with her. And that's also going to help stop potential depression that we're going to see. If you have nobody, if you're living by yourself and you just have a dog or a cat, that can be terribly depressing, especially if you can't go outside. That being said, the CDC does recommend going outside, going for walks. Just don't do it with thousands of other people or even more than 10 other people. Call your Nana. Stay in touch with your aunts, your uncles, your family members, especially if you're in the medical community. We have a certain responsibility you don't have to know it in depth. You don't have to get a PhD in this, but call your loved ones, call your family members, let them know. There's a lot of misinformation out there. So they're going to, one, love to hear from you because they're probably pretty bored and lonely. And two, it's going to give them that pep. It's going to help prevent social depression that we'll probably see rise with this isolation as well. Any other comments you ladies want to make on the matter? Or?
Well, I just want to add to it or segue into the community service aspect of it. So as Drew, as you just mentioned, we want to be aware and cognizant of, we don't want to potentially be carriers of this virus and potentially infect others. And the CDC does have a forecast out there that unknowingly infected individuals or asymptomatic individuals can infect up to 2 to 3 other people before symptoms are even present. And so with that being said, we want to limit our direct or physical interaction with those populations that can be at a higher risk, such as our older populations. So if you are out there performing community service, if you're working with, older populations, even if you're working with children, kind of step back and think, am I potentially putting a population of people at risk by pushing forward with these activities? So we have to determine what's non-essential at this time, what can be postponed, what can be canceled, because this is a community effort in, preventing the spread of this virus. And also, as we talk about community, we need to also talk about our blood supply. Our nation's blood supply is severely low. We haven't seen these low levels in a very long time. So if you are healthy and if you are eligible to donate blood, we please beg of you, we encourage you to please donate blood. We're going to need blood products to still help with other patients. And once again, that's just another way of, doing something that you're feeling like a need to do something to help your community. This is one way that you can do it. So if you're open to doing it, if you're eligible and you are healthy, the public is encouraged to still continue to show up to blood donation centers to donate blood.
One caveat I would put, I'm somebody who nerds out over statistical disease spread. There's a lot of numbers out there, and to be honest, a lot of the news media are reporting the more negative statistics. Remember, a 2% chance of fatality means a 98% chance of life. So try not to fall victim to the negative spin on a lot of the, I don't want to use the word propaganda out there, but ultimately it's a lot of scare tactics out there. And to be honest, there's some validity to that. It is important to distance yourself and be safe. But at the same time, remember, the impact of these statistical models takes into account the worst case scenario many times. So we've seen all these numbers that between 160 or 210 million Americans could get this virus. That's not telling you that 60 million to 210 million people are going to die. We saw earlier in that statistic that only, 81% of cases show very little effects at all. So, I mean, take those numbers into account. Don't fall victim to the easy negative statistics out there. And really, the end of the day, and what I've read is the caveat of a lot of these statistical models is we can really make these numbers significantly smaller by taking personal responsibility and self-isolating. Don't sit in a room with two other people recording a podcast. Don't go visit your grandma. Just be smart about it. And honestly, I know it's going to suck to sit inside for two months. I'm a terribly extroverted person, but you're doing it for humanity. And I know March Madness being canceled sucks.
School, graduation, proms.
And shout out to all the parents taking care of their kids who are out of school right now. I can't imagine how you're doing that. High five. That's
Purell,
we touched. Purell. That being said, be safe, wash your hands, and that's all I've got for you today. Anything else, ladies?
Please stop hoarding.
The
recommendation out there for stocking up for your home is enough supplies to last you at least 2 weeks. We're seeing fights take place over toilet tissue. Toilet tissue is not a replacement for a facial mask. So, I know panic is setting in, and that's just part of human nature. We're not supposed to say do not panic, but just be mindful. Sharing is caring. If you have more than enough for your home, your family, don't feel like you have to buy it all, especially if you see everybody else buying so much. So get what you need. And if you see someone else in need, be willing to share. That's all I have to add. Letty?
I think that we've all been seeing a lot of, like Drew mentioned, different statistics, and there are studies that show that just listening to this more blown out of proportion numbers generate fear, and the more times they report a death, like if a death is reported in the media, fear goes up in the population. Fear can be a good thing when it's protecting you. So protection here, the advice from the common sense advice is just that physical distancing. So try to stay away from people who could potentially be infected, or if you might potentially be passing this on to them. But other than that, being afraid of each other, treating each other poorly, and we want to care for each other. And this is why we're doing this. This is not because we're trying to do something that is going to be detrimental. And so, yes, isolate yourself physically, but it is a great opportunity to connect with others using the different media that we now have. We have now more information than the Spanish flu outbreak 100 years ago. So now we have to deal with that amount of information, being able to rely on the actual places where we can seek true advice rather than fear and scaremongering. So don't be afraid to contact the people that you love using the telephone or FaceTime.
One last thing, and then we'll get out of your hair. Make sure, this is a tough time for a lot of the businesses, small businesses specifically out there. Don't check your 401k. It'll just lead to sadness. But do try to give your business to small businesses if at all possible. There's people out there who depend on it for their livelihood. So if you can, buy small business this time. So unless you got anything else, this has been the Specimen Not Found podcast. I'm Drew Jones.
I'm Dana Bostic.
And I'm Letycia Nunez-Argote. Make sure you follow us on Facebook. We also have Instagram accounts for ourselves, and we'll be posting additional information on LinkedIn and Twitter.
And the Twitter. Yes.
Yeah, so make sure you follow us, and our website is cls.kumc.edu. It's been a pleasure. Stay safe.
Stay healthy.
Wash your hands.